thoughts as to what anyone thinks this could be?
The vessels seem to be running through it. Like, is it severe fat and cirrhosis?
Do we have another phase? Can we put it side by side?
Yeah. So
oh, yeah, we're still dealing with that thing. So there, yeah, so there looks like
I've seen some cases look like this that end up, when you do MRI, being a lot of steatotic nodular hyperplasia in the liver.
excellent. Yeah. So can you see my screen, Chrome?
Yeah, we can see it.
Okay, great. So that's exactly what it was. So the patient went on to get core biopsies, and it came back as steatohepatitis. So here's, so what's true about fatty liver? It's diagnosed by a difference of 15 pounds per unit from spleen on non-con. You get increased signal on a post-phase imaging. It's differentiated from infiltrative HCC by lack of mass effect and no contrast enhancement. It enhances on delayed phase. Any guesses? So yeah, so fatty liver, typically it's 10 pounds per unit we think about on non-con compared to the spleen. Attenuation less than 40 pounds. On portal venous phase, we use a 25 pounds per unit cutoff, a differential compared to the spleen, and there's variable patterns. So it can present as nodular, it could be periportal like our case was, it could be irregular, it can, and it could be, here is a case of nodular where you see a signal dropout on a post-phase imaging. So it has different presentations. So to differentiate that from infiltrative HCC, which was what this case was called, or that was in the differential diagnosis, and it's reasonable. The difference is that with HCC, you have mass effect and there's mosaic enhancement. Because steatosis is fat, you should not see enhancement on arterial phase. And of course, if the HCC is large enough, you can get portal vein invasion. And there's background cirrhosis and varices. To differentiate that from Chiari, which was the other differential diagnosis that was raised in the original report, with Chiari, you see the pattern typically only on arterial phase. It goes away on the portal venous phase.
But just like 2 minutes ago, it said. But then you may be related to the network.
Contrast to fatty liver, where you sort of see phases. So here is an example of another mimic. So to differentiate from inflammation with
Victoria needs to mute.
You get enhancement because there's inflammatory changes on the delayed phase, whereas with periportal fat, you don't get enhancement.
I'll keep an eye on it.
There was, and the explanations here. Questions?